Thank you, Flag. And is it on?
Yep.
Oh, perfect. Thank you. Thank you for letting me present here today. So I think you should have been living in, a cave if you didn't hear about the results from the EMPIRIC and the CANVAS outcome trials showing a reduction in cardiovascular death and hospitalization for heart failure when people are treated with SGLT2 inhibitors. Now, epidemiological studies have suggested that this is probably a class effect, and so that's what we believe in. You want to examine the effect of the SGLT2 inhibitor dapagliflozin on cardiac function measured by echocardiography. We did this via a secondary analysis, but it was pre-specified on a double-blind, placebo-controlled, randomized study on dapagliflozin 10 milligrams versus placebo. Treatment period was 12 weeks. We had 36 patients completing the study, and as you might know, crossover study means that everybody receives both placebo and dapagliflozin, and we had endpoints at after treatment periods. So moving on to the results, first of all, the baseline characteristics. These were, one of the inclusion criteria I forgot to mention was albuminuria, so at least microalbuminuria, and a sort of typical population of type 2 diabetes patients with microalbuminuria, predominantly male, 64 years in average, and a diabetes duration pretty long, 16.4, pretty heavy, pretty high systolic blood pressure, and it should also be mentioned that everybody were on RAS blocking treatment. Also worth noting were that about 30% had a former cardiovascular event. And for the sort of endpoint results, I'd like to part them up into three parts. I call them the basic ones, the echocardiography, and the biomarkers. Now, first of all, for the basic results, it's pretty much a confirmation of what's already been shown, showing a decrease in measured GFR, decrease in urine albumin-creatinine ratio, decrease in HbA1c, and a decrease in 24-hour blood pressure. However, the systolic one was non-significant. Then for the echocardiography measurements, we had some systolic endpoints and some diastolic endpoints. Now, the three systolic endpoints showed no effect of dapagliflozin. So the two diastolic endpoint showed a numeric, however, just non-significant improvement in diastolic function. Now, we also had a lot of other echocardiographic parameters, and it should be noted that when the European and the American Society of Echocardiographies, they recommend how to evaluate diastolic dysfunction. They show 4 different parameters, and they were all non-significantly sort of in one direction. So what we did was we took those 4 parameters listed up here, and we combined them into a composite endpoint weighted with the inverse variance. So this is just a statistical maneuver to make it into one endpoint, which actually did show a significant improvement in diastolic function in this group of patients of almost 20%. Lastly, for the biomarkers, it showed, we thought that a reduction in the level of these biomarkers would indicate that reduction of cardiovascular risk, and there was absolutely no significance in the traditional biomarkers. However, we did see an increase in the copeptin. Concluding, we saw a possible, we saw a numeric improvement in diastolic variables, and we saw a significant improvement in this combined endpoint. I should also mention that it is exploratory and it is experimental, but however, I still find it interesting. Possible diastolic improvement with dapagliflozin, and also no improvement in cardiovascular risk markers, an increase in procapeptin, and we do believe that that is due to the diuretic effect of the SGLT2 inhibitors, or dapagliflozin in this case, and that is sort of a reaction to that. So thank you all for your attention, and I'll be happy to take any questions.